If you or someone you know in your family suffers from heart disease, no doubt, like me, you always pay very close attention to any information that doctors have to share concerning your heart health. So the month of September happens to be a focus on AFib Awareness Month. And we're so happy this morning to have Dr. Samuel Jones from the Chattanooga Heart Institute join us for a bit of an education. Good to see you this morning.
Thank you very much, Julie. It's great to be here.
So heart disease does run in my family. So those were very true words from me. I pay very close attention. As I understand it, though, Dr. Jones, AFib is kind of its own unique little creature in the world of cardiology.
That's right. Atrial fibrillation is just one of those many confusing medical terms that we throw out that can sound scary. But what it really is an irregular rhythm of the heart. And patients will come to us and they'll say, I feel, doc, that something's going on inside my chest. I feel like there's skipped beatings, or sometimes I feel like there's a fish flopping in my chest. And at its core root, that is what we find, is that patients are feeling something, they're concerned about it, but it is basically that the heart is no longer in its normal rhythm. It's developed an irregular rhythm. And it's critically important that we find out about it because there can be some very serious health risk associated with it that we need to treat.
Now that's very different, isn't it, though, from a heart murmur? A heart murmur is something that you can sometimes simply live with quite successfully, but irregular heartbeat is concerning, isn't it?
Yeah, that's a great question because I think all of us at some point in our lives have been told we had a heart murmur or one of our family members had a heart murmur. And that often relates to something that the doctor will hear, and it's the blood flow as it goes through the heart, usually related to a valve problem as the blood goes through the heart. But the irregular rhythm of the heart is really due to the electrical problem. And so that's what we find out, is that the heart is suddenly skipping beats, or it's having an irregularity of the rhythm. So it definitely is different from a heart murmur. Typically, when we think about the heart, we think about it being a pump for the heart. In other words, it has to get the blood in, and it pumps out that blood to the vital organs, to the brain, to the kidneys, to the lungs. It's got to get that oxygen and nutrients to the rest of the body. But in order for that pump to work, so many different things. It's just a beautifully designed system. We need the electrical system to work. We need the valves to work, like you just talked about. And all that has to work to make sure that it's doing what it needs to do for the body.
Okay, I'm going to jump around a little bit. I know you want to get into symptoms of it, but before we do, is this something that you tend to be born with, or can a life circumstance then trigger atrial fibrillation?
We do think that some of the conditions of atrial fibrillation do come from family and something that we pick up from our mom and dad, but the majority of it is something that happens, one, with age. We know that 60-year-olds are more likely than 30-year-olds,
Okay.
70-year-olds more likely than 40-year-olds. That's just one of those things that happens with age. But a lot of it, though, does happen with things like high blood pressure. Most of our patients with atrial fibrillation are experiencing high blood pressure. So the more you control that blood pressure, whether that's through diet, exercise, or taking medicines, then that will help. Other things that are very important, sleep apnea. So many of my patients come in and it turns out that they're snoring, or I talk to the spouse and I say, are they snoring? And of course oh yeah, they're snoring all the time. We treat that sleep apnea and the atrial fibrillation gets better. The extra weight we carry on often puts more pressure on the heart, and that can create more problems of atrial fibrillation. The other things I always talk to patients about are something that we take into our body. So alcohol being probably the biggest one. If we drink way too much alcohol, that acts as a toxin for the heart, and patients will have more atrial fibrillation. Way too much caffeine. So a cup or two of coffee, we all like that, and that's okay. But when patients come in and they're having the Red Bulls and they're drinking 5, 6, 7 cups of coffee, that's not good for them.
Okay, and when you talk about too much alcohol, not to get too in the weeds, but are you talking a glass of wine or something a day, or are you talking more than that?
So this is a great question because we get so many different reports, right?
Yeah.
CNN wrote an article saying alcohol is good for your heart. You ought to have a glass of wine. And I think that in general, if you have more than 1 or 2 drinks a day, that's too much. But we do know that patients with atrial fibrillation many times are uniquely sensitive to that. And so any amount of alcohol probably can trigger more atrial fibrillation. I had a great friend of mine that had atrial fibrillation, and he went to just having a glass of wine a week. His atrial fibrillation got better. He went to no wine, and he liked his wine, but his atrial fibrillation went away. So I think some people are uniquely sensitive to it.
Okay, so obviously you mentioned the sleep apnea and some other things that could be warning signs, but are there other symptoms that you would just feel in the course of living that are signs that you might be having this?
Absolutely. Many patients will come to us and they feel that their heart's racing or they feel skipped beats, a butterfly in their chest. Sometimes it's not even that though. Sometimes patients will come and they just say, something's just not right. I used to be able to go up 2 or 3 flights of stairs, but now I have to stop in between that. And they just don't have the normal energy level. But I also say that every now and then we have patients that don't have any symptoms at all. And they come in and on EKG, it is found. So there are a subset of patients that don't have those symptoms. So that's why I think it's critically important to just be aware of any symptom that you feel, or if you end up getting that diagnosis, that you do get that looked at carefully because there can be some serious health risks. We have so many different ways to find atrial fibrillation now. Patients often are coming in with these smart watches, they're finding things on their smartphones, or they're wearing monitors that can be for 24 hours or even up to 2 and 4 weeks at a time. There are many different ways we can find atrial fibrillation. And once it is diagnosed, we very much recommend that they come see heart specialists to get the proper treatment for that.
Okay, before we get into treatments, are the symptoms different between men and women, much like a heart attack symptom can be different?
We do know that men and women experience different symptoms, and for many disease processes, it can be. For atrial fibrillation, and really with all heart disease, it seems that sometimes women just don't have that normal symptom pattern for it. But like I said, I think it's hard to determine. Each person's an individual. No one person is the same, and that's why we really recommend if you're having something that you think is unusual, that you go seek help for it.
Okay, so do you typically try to treat this through a medication, or do you counsel the person in their lifestyle and perhaps you go straight to a procedure?
Yeah, great question. And I think it's all the above. Each person's unique, and we try to find the right treatment for the right person at the right time. The lifestyle is critical though. And so we try to make sure that we talk to each patient about what can we do around your lifestyle to get that better. If it's getting them treated for sleep apnea, sometimes patients will come back in 3 months and they say, I'm sleeping so much better. My life is better. The wife is saying, I'm sleeping so much better. My life's better. And so I think getting that lifestyle is critically important. For the atrial fibrillation, though, one of the most important things is realizing that patients have a 5 times greater risk of stroke because the blood is not going through the heart. And if it forms blood clots, then those blood clots can leave the heart. And if it goes up to the brain and causes a stroke, that can be devastating. They can lose the ability to walk or to talk. And it definitely can have an issue of increased mortality. Patients die from strokes. So the number one thing we have with atrial fibrillation, those patients who need to take blood thinners, we want to get that under control. The second thing though is when patients feel symptoms of it, there are a whole host of things you can do. Medicines is usually one thing that we look at, but some patients, the medicines don't work or it's not right for them. And so that we do recommend them come to a place. We have a heart rhythm center at the Chattanooga Heart Institute where we have doctors in cardiology who specialize with electrical abnormalities called electrophysiologists. That's what I do. And we may have procedures that may be where we take different wires up to the heart and we try to treat it in that manner.
And because you are at the Heart Institute now, this comprehensive care center, I think you're the only one now in the Southeast offering all the different services you have. Um, Often I'm guessing that somebody can come in with one showing within the world of cardiology, but damage to the heart can lead to other issues down the road. So that's beneficial, I would think, to the patient.
Well, like we talked about with atrial fibrillation, there can be all these other situations that happen with it. And whether that can be all those other lifestyle changes, but sometimes we'll come in and they're actually having atrial fibrillation or their EKG showed it. And then in the course of the workup, we find out that they have a valve problem. You talked about that before with murmurs.
Right.
And actually what we need to do is correct the valve problem first, and then we need to correct the atrial fibrillation. And so I do think having that comprehensive care like we have here, where we have cardiologists and heart doctors and surgeons that deal with valve issues or that can do surgery for things. And we have imaging specialists that help us all the time. And so I think that team approach is very important to any patient, but certainly for atrial fibrillation.
Well, you have given us quite the education this morning. So if anyone is thinking, okay, that's where I want to go, can they self-refer or do they need to have a recommendation to you from their primary care doctor?
We would have anyone, we should be able to put up some information about how to get into contact with Chattanooga Heart Institute. And I think really just getting it looked at is the most important thing. In this time of COVID, we know that people are scared. They're worried about their heart. We're all worried about our health right now. And so I really just encourage people that if you're noticing something that's unusual, that you go get it looked at. We've got to take care of ourselves. We've got to mask up. But at the same time, the weather's getting cooler. We got to get out and start exercising, and people may start feeling things. So I really encourage people to take care of ourselves in all the ways that we can.
Dr. Jones, such a pleasure. Thank you so much for your time.
Thank you.
We're back with more in just a minute.